is Stan, and I've been coming to this practice for many years, starting with the founder, James Fogarty, Dr. Fogarty. He operated on my wrist. When I came to him with problems, I was having trouble shaking hands. I shake a lot of hands all day because I'm in sales. And he had to consult with a few people and determine what my problem was. And he did surgery on me and did an excellent job. As a matter of fact, I've seen him since then. He was amazed it still works because I don't have any problems. And so that's how I found this practice and this doctors. And then fast forward years later, because that was in the early 2000s, and then fast forward, I had a back issue. I couldn't even sit still and not be in pain. So I went to, I met Dr. Mohr, because I had researched all the doctors that I felt were the best ones in the area. And I found Dr. Mohr. He had excellent credentials. He was picked by Dr. Fogarty. And I went to see him, and working with him and the pain management doctor, Dr. Wiggins, we decided a plan of how to and where to fix where the problems were. And I never had or heard of a successful back surgery from anybody I've ever talked to. And I had a back problem and I needed it fixed. Dr. Mohr told me what he thought. We were looking at neurosurgeons versus orthopedic surgeons, and there's a difference. But I felt comfortable after speaking with him. He was the person I wanted to do the surgery, and that was exactly what I wanted to do. He operated on me, and for 2 weeks it was heck, because I had to go through rehab. And at the end of 2 weeks, I was like perfect. I had no pain. And I asked Dr. Mohr, I said, can I hug you? Because I was so happy with the outcome that I actually hugged the doctor and thanked him. It was just a great outcome. Fast forward a few years later, my knee bothered me, my left knee. I went to Dr. Fogarty because he was my guy. And he decided we're gonna do a partial, because whatever he told me I was gonna do. He said, we need a partial knee. So I put a partial knee on the left side. Fast forward again, 13 years later, Fogarty was gone, 14 years. And I researched again who are the best orthopedic people. And Dr. Tanous, who was also handpicked by Dr. Fogarty, I decided he was the guy I wanted to go to. He was younger, he had all the modern techniques, including robotic assistance. I went to Dr. Tanous, and it took me about a year to decide finally what to do. And I decided finally to do the right knee, a full knee. So I did that, and he did robotic assistance, and he said he didn't really need it if I didn't want it. And I did use it, and it was, again, I'm good. Got through the surgery. First 2 weeks was not easy. I went through rehab. But after that, I was like perfect. And I said, Dr. Mohr, can I hug you? Because I was so happy. I gave him a big old bear hug because I was perfect. There are 3 things I can tell you without a doubt that is true about surgery. Number 1 is pick a good doctor. That's obviously key. Then you have to decide to be a good patient. And the third one is have good physical therapy. And I have the best doctor, in my opinion, for me. I was a good patient. I abided by everything he said. And I went here to this practice for the physical therapy. I can tell you, I had first class everything. They took care of me. They were very professional. I consider them all friends. I know all of them. I just came out. I haven't been there in several weeks. I just went in there and hugged everybody and said hello. Those people are great. John Youngblood was my physical therapist. I can name every person in there. Gerard was one of my techs. Victoria is the reception person. That's probably not her title, but she does scheduling and everything. Megan does hand. They're all great. Everyone, Liz, I can name them all, Tony. I know them all, and they're all wonderful people. And Christy, I have to mention Christy. I gotta hug her every time I see her. I love her, about that tall. There's not a bad one in the bunch. They're all wonderful. They all care about you and your health care. They're very professional, and they help each other. So if I'm not with John, I'm with Christy, or I'm with somebody else. Liz will criticize me. You're not walking right. They want you to walk without a limp. And John will tell me, do not practice limping. So you had to walk right. And they prepared me for right now. I'm pretty darn good. Well, I had pain all the time before my replacement. And when I slept, I remember asking Dr. Fogarty many years ago, how do you know when you're ready for knee surgery? He said, if it keeps you up at night or if it wakes you up at night. And I had like a 6 some nights, and most of the time 3. It's about 3 months, I think, until your pain subsides from laying in bed. So I had no pain. And now I have pain when I sit too long and I stand up. It takes me a minute to get my engine going. But after that, I'm golden. Like right now, I walked in there, I didn't limp because I have 30 people in there telling me if I'm limping, and I did not limp. And so I've had a great outcome. Everything is, like I said, very professional. People are very friendly. Everybody. It's not just the doctor who I love, but Katura, I got to mention her name, give you a commercial. She's very professional, very thorough, and she will get back to you pretty quickly. So the doctor, everybody's been just wonderful. Dr. Tanous is very professional. He's very honest and straightforward. There are no secrets like sometimes you feel a doctor's holding back on you. Not Dr. Tanous. Tells you exactly what you need to know. He's very friendly. All the things you'd want from any human being. But from a medical point, he's very blunt and tells you what it is and answers all your questions. I don't know what else you want from a doctor. And he's almost like a friend. Dr. Mohr, I have to smile when I say him because I was so nervous about back surgery. And I think what I like most about him, first of all, his bedside manner after the fact, but telling me up front what was going on and how I was doing and what he was going to do. He even explained why he thought the difference between neurosurgery, neurosurgeon, and an orthopedic surgeon. He didn't say anything bad about anybody. He just explained to me, in my case, what the benefits were using an orthopedic surgeon, specifically him. And I had already done all my research and homework. I knew he was a bright guy, and I knew where he went to school. I knew everything about him. But he's just a great guy. I mean, he's a person you want to hang with and go have a beer. But he was, again, he drew diagrams and he told me exactly what he was going to do. And when he got done, because I had nerves that were stuck in the lunate in the backbone, and I was born with it. But he told me he took a paper clip just to show you the kind of person he is. Took the time and showed me how it was a rounded off instrument, and they go around to make sure there's no sharp edges on what he cut, to make sure that this would not reoccur. He just went into great details, which I needed. Dr. Mohr is wonderful. He's a good man and a great surgeon. And so I could say the same thing about Dr. Tanous. It's all about character.